Hello everyone. Today my topic will be shock. Again, it's a second year pathology frequently asked question. So, shock is a very big topic, but I will make it short and including all the points in it. So, your answer should contain at least these points. These points are easy to memorize and also it is a value point also. So, shock. First you have to write the definition. It is a life-threatening clinical syndrome which is showing a cardiovascular collapse. So shock is literally a serious clinical condition in which there will be circulatory collapse or a cardiovascular collapse. It is characterized by acute decrease of circulating blood volume and inadequate perfusion of cells and tissues. These two are the main points, that is inadequate perfusion of cells and tissues and acute reduction of circulating blood volume, which will lead to impaired cellular metabolism and leading to death. Now we are telling two types of shocks, that is primary shock and secondary or true shock. So secondary or true shock means this circulatory shock is also named as circulatory shock. Circulatory shock, circulation, which means that oxygen supply and the oxygen requirement imbalance, that is circulatory shock or secondary shock. Primary shock is the sudden decrease of the venous return to heart. That could be due to any kind of trauma after any accidents or anything like that, and only lasts for few seconds to minutes. It is due to the neurogenic vasodilatation. Next important what you have to include is classification of the types of shocks. One is hypovolemic, next one is cardiogenic. Hypovolemic means the inadequate circulating blood volume. Hypovolemic blood volume. That may be due to two reasons: cell mass and the plasma volume reduction due to loss from bleeding, or loss of plasma volume alone. Cardiogenic means, as the term said, it is acute circulatory failure leading to reduced cardiac output without reduction in the blood volume. Next type is two more types, septic and other rare types is traumatic, neurogenic, hypoadrenal. Septic is, as the name suggests, is from a septicemia due to a bacterial infection, either a gram-negative or a gram-positive bacteria. The pathogenesis, the important part in pathology you must include is, it is due to three types of derangements. Shock is due to three types of derangement. First one is reduced effective circulating blood volume, second one, reduced supply of oxygen to cells, leading to, another term for it is anoxia. Third one is inflammatory mediators release and toxins released from the shock which is inducing the cell injury. At that time the toxins released and the inflammatory mediators. So then we will explain these 3 points. The first point, as we told, is effective circulating blood volume. So the loss of blood volume results in decreased, the loss of blood volume, two factors are there in that. One is loss of blood volume, that is hypovolemic shock, and second one is reduced cardiac output, that is cardiogenic shock. Second, we told is reduced supply of oxygen to cells. This leads to reduced venous return to heart, resulting in reduced oxygen to cells or any organs, resulting in cell injury. Third type we told is due to the cell injury, the body's immunity mechanism will release some inflammatory mediators. Example, TNF alpha, and that is tumor necrosis factor alpha, and interleukins IL-1 cytokines. Next is the etiology of shock, the reasons for the shock. In that three types of shocks reasons we are telling. Hypovolemic shock, the reasons could be acute bleeding or dehydration or burns. Cardiogenic is due to deficient emptying or deficient filling, and septic is due to gram-negative and gram-positive bacteria. Next is pathophysiology, important part, stages of shock. You must include these also. Compensated shock, progressive decompensated shock, irreversible decompensated shock. Then we'll explain each in detail. First one is compensated shock. Initial stage, to maintain the brain and the heart circulation, the body itself does a redistribution of the blood circulation, and this is a neurogenic hormone mechanism in which there will be a vasoconstriction and fluid conservation, that is a fluid conservation by the kidneys, and this only happens, the initial stage happens only if it is treated. Other second one we told is progressive, that is in cases where patients have other risk factors like pre-existing cardiovascular diseases or lung diseases. At that time there will be more decrease in health leading to pulmonary hyperperfusion, tissue ischemia, etc. Third one we say is in no changes are seen in case of treatment, that at that time the third stage, that is a progressive vasodilation happens, increased vascular permeability and myocardial depressant factor, worsening pulmonary hyperperfusion, anoxic damages to heart, kidney and brain, and hypercoagulability of the blood. Next, two small points which are also important and easy to memorize also. The first is you have to include clinical features, then the complications, the last step. So the clinical features is very high BP, that is the first clinical. Next is subnormal temperature, reduced body temperature. Next is feeble or irregular pulse and shallow respiration. In majority of the patients, characteristic what you can see is the physical features is the pale face, sunken eyes, clammy or cold skin. Next is complications. What are the complications is ARDS, that is acute respiratory distress syndrome, and DIC, disseminated intravascular coagulation, acute renal failure and multiple organ dysfunction syndrome. These are the points that you should include, most important points that can give you maximum marks in if you have a question from shock. Normally, frequently asked question is this. Thank you for watching my video.